So we're discussing the session on women's oral health. So Purnima, why do we need to have a defined session on women's oral health? And why is this important for everyone, not just women?
All right, and two questions in one, huh? Two for one. All right, let's do it. Why do we need a session on women's oral health? Because we haven't had one. We've never had one, and this is going to be the first time ever we're going to talk about it. So why do we even ever need to have one? Simply because of female physiology undergoes a lot of milestone changes. That we are not as apparent in the male physiology. Not to compare men to women. If you take a why do we need something on women's health, is because of women's physiology undergoes very milestone based changes that are related to her sex hormone levels. She also undergoes changes that are simply age related, and some women enter early menopause, surgical menopause. Some women never get pregnant in their lives. Some women never have a period in their lives. So it's not all sex hormone related. Some women work out, are fit. They have excellent muscle and bone, muscle strength and bone density. So they're not osteoporotic. Some women are. So many things happen that are unique to women. And, I always tell my patients this thing. I tell my patients, the mouth is not Vegas. What happens here doesn't stay here, right? So things that happen in the mouth can have an impact on the rest of the human body. And it's not directly just, bacteria are going to go colonize there. They have multitude of effects. But when you think of a woman or any other physiology, and when you think of the mouth specifically, it's so fun, right? Because the mouth is one of the few organ systems in the entire body that sits at the interface of the external environment and the internal physiology. So things that happen here are impacted by everything, right? And more importantly, the mouth, unlike the skin, is an organ of comfort. You use it to eat, you use it to drink, you use it to kiss, you use it for things. For some people, having oral contact, having a dentist in their mouth is very personal and negative, can have both positive and negative. So it's psychosomatic, it's physiological, it's everything. So because we're talking of the mouth and oral health, and because of these multitudes of impacts that can happen, there needs to be a focus on understanding what is women's health and what things happen specifically that can be shown for a woman, right? Why did I even come up with this topic? And Leor and Tony and I have been talking about this for at least 2 years now. And the reason I started this train of path, and I was pushing these two gentlemen to say, please say yes to this session, is because of the work that we did where we finally sequenced about 1,000 human beings. And we segregated them based on sex at birth. And we looked at 0 to 80-year-old women, 0 to 80-year-old men. And we looked at their oral microbiome, the subgingival microbiome. And we looked to see how does age versus sex interact, right? First thing, men are from Mars and women are from Venus when their oral microbiomes are concerned. No matter what age you take, they're completely different. They sit in two different sectors of the map like that. It's very cool to see that map. It's so cool. The second important thing, which is far more important, is that, for women at age 30, there's a sharp decline in the number of species that are colonizing them. Like 30 is almost like that break point. It's like that. And there are some very marker species. Fusobacterium nucleatum. We've all heard of Fusobacterium nucleatum, right? FNUC. Rathia dentocariosa. Specific organisms that suddenly start like literally from like parsley overgrowing the entire oral microbiome. For men, it's not like that. There is no defined age where there's a break point, there's no change, it's all like popcorn, it's all over the place. And the male microbiome is so much more personalized. Men to men, the differences are much more than women to women within the same age cohort. Which tells me something very important. Personalization, when something is highly personalized, it tells us that the human physiology is not able to control it. And evolutionary biology is not able to have the same impact on the process as it does on other things. So I feel that there are some protective mechanisms at play in a woman's journey through life, the female microbiome journey through life, that we don't readily see in a man. So we want to understand what these protective influences are and how we can take that knowledge and expand it. You know, one of the most powerful papers that I ever read is called Why Elephants Never Get Cancer.
Okay.
I mean, if you've never read it, just Google it and read it. It's fabulous. It talks about telomere silencing. And you know, we all get cancer because our cells age and telomere silencing, and elephants' cells don't have telomere silencing. So there's a protective mechanism there that now became therapy. And so really, I think there is potential for us to explore these, yes, risk factors and susceptibility factors that might be endemic and built into the female physiology over time, but also the protective factors that are evolutionarily conserved that we might be able to harness as maybe therapeutic objectives.
Okay, so you could maybe take the innovation in the research in women's oral health and transfer
Expand
it
it.
more
Yeah.
globally, expand
Yeah,
it into
expand it.
male research as well.
Absolutely. It doesn't have to be male research, human research, right?
Okay,
It
okay.
just becomes human research at that point. So then we start studying that and understanding all the different nuances and yes, all of that.
Okay, and in terms of new diagnostic technologies, then you've already alluded to microbiome research, but how do you think this has the potential to bring us forward in this area?
So we were talking about it this afternoon in our session which is chaired by Mariano Sanz. And so Maurizio Tonati and Andrea Pilloni and myself were speakers in the session. And we were really talking about, the poor resolution capability of this probe that is calibrated at 1 millimeter intervals and a 2-dimensional image of a 3-dimensional structure. And, that's what we're using for diagnostic tools. And we question our classification systems and we question our diagnosis. But essentially, it all boils down to the resolution power of those two very limited instruments, right? We should start looking for more real-time diagnostic markers. And we just concluded a workshop sponsored by the EFP. The paper, I think, came out this week, where we looked at diagnostic markers, and we found there are no diagnostic tools currently in the market. So we've had about 100 years of periodontal microbiology, and most of it has been focused on identifying boutique species, right? Just as this class or cohort of species that is like, can be a marker, can be a, So we're finding out that that is not the story anymore, that if we relied on species names, we're really not going to get anywhere. The same species in your mouth will react very differently if you had a protein-rich meal versus a carbohydrate-rich meal. It'll just express a different set of genes. Okay. And once it expresses a different set of genes and creates a new set of proteins, the human immune system sees it as a completely different foreign organism.
Yeah.
Right?
Yeah.
So it literally is a sheep in wolf's clothing, if you will, or a wolf in sheep's clothing, what you will, depending on the time of day and the type of food you've eaten, right? To your immune system, it's the same organism, but it sees it in two different contexts and responds to it in two completely different ways. And so we need to start recognizing that and harnessing that. And so today I said, let's stop being species-centric. Let's start becoming gene-centric. Even going to go down and say, let's become protein-centric. Okay. Let's start looking at tools in a more granular, more meaningful level and understand that this is a very dynamic environment that's constantly responding to something.
Okay. So
right?
You're saying then, you alluded to the fact that this is the first session on women's oral health. So let's look 10 years in the future. How do you see this taking shape to grow this research and people's interest in it?
Good, great question, thank you. So when you look at, people, when I first proposed this session, the general feeling was, we already know. We've studied pregnancy microbiome, we've studied puberty, we've studied birth control pills, right? We've studied all of that. What's new? It goes beyond that. It really goes beyond that. What we're studying is the trajectory of change that occurs and all the different factors that can contribute to the trajectory of change. And what we learned, and this just came out in a journal called Microbiome, and the second is going to come out in a journal called ISME, through our own research, is that bacteria can travel from a female's mouth through her bloodstream and sit on the placental side of her microbiome. No, the maternal side of her placenta. So you know, right? The placenta has a maternal side and a fetal side, and they're connected by this blood-brain network of capillaries that forms the blood-brain barrier. So bacteria cannot pass from the maternal side to the fetal side. But what can happen is the fetal immune cells that are growing, the Treg cells that are just developing, the antigen-presenting cells that are sitting there, they look at this bacteria on this side and they start recognizing them as friends. So the immune education begins in utero. So when the baby is born and the mother takes the binky out of her mouth and puts it in the baby's mouth, the baby's immune system is already trained to recognize these bugs as friends, right? And accepts them as her own. Whereas when the baby crawls on the floor and eats that little thing, it's seen as a foreign thing and is rejected by them. So this is how the gatekeeping, right? The mouth is truly a gatekeeper, and I call it a mouth guard. So the microbiome are really the mouth guards, right? So all football references here. So the gatekeeping happens, the goal posting happens very, very carefully in the mouth by these very evolutionary mechanisms. Now, this is all great and wonderful, but what if the mother has periodontitis, right? Bacteria move from her mouth to her placenta, and the baby's immune system is now being trained on these periodontal pathogens to recognize them as friends. And so when the baby is born and the mother still has untreated periodontal disease, and the binky goes from her mouth to the baby's mouth, the pathogens are being accepted into the baby's mouth. The pathogens are still pathogens. They still express those virulence factors that the immune system sees as foes.
So maybe final question is, does this potentially offer us a route into understanding why we get the expression of what we used to consider aggressive forms of periodontitis?
See, yes, it could be possible. The Trojan horse story, right? It's a true Greek tragedy. Yeah. So now it could be. And today I was talking about it. There's multiple lines of evidence to show that parents with a certain, who have the younger aggressive forms of periodontitis, their children have a dysbiotic microbiome that's already set up with high levels of virulence factors from before they get teeth. So there is pre-dentate pathogen enrichment, virulence enrichment that has happened, and it continues on through the different dentition states. And we tried cleaning their teeth and offering them professional prophylaxis and getting them, but that didn't change it. So it's not simply because they don't, we always say it's a dirty mouth disease, right? It's not. It's more than that. So there is definitely a vertical component that seems to be associated with all of these things. There's also a component that shows us that, we need to learn much more about these aggressive forms of disease that affect younger individuals. So there's something going on there that we need to explore further. But as long as we use the lens of Aggregatibacter actinomycetum comitans, or we use the lens of, let's look at specific species, I don't know if we will get new results, So we really have to be there. And I really think if you understand a woman's health and you're able to treat her, you're saving her generation as well as the health of the next generation. So you have the potential to impact 2 generations with treating one person. Okay. Right?
Yeah.
Yeah. So to me, I think there's value in studying women's health for several reasons. One, women have a different physiology, so understanding that. And so mapping physiology to microbiome, which has never been done, needs to be done. Second thing, understanding what influences protect. You and I were talking a few minutes ago and you said women don't have as much periodontitis as men, so why is this a concern? True. And if you look at the same literature, it always says because men have poor oral health and because men don't go to their dentist often enough. Well, that might be true. Have we truly decided that that is the only reason why? Are we really ready to pin that entire vest onto that one button, right? We don't know. We haven't studied it in depth enough for us to be able to make these very big statements regarding that. 3, when you treat a woman, you treat her offspring, the potential offspring that she might have. So everything that goes on needs to be there. So So to me, studying women's health allows us to focus on an area of research that is scalable, that can go deep, and that's expandable to not just the entire human population, but 2 generations or more of human populations.
Thanks, Purnima. That was fascinating insight into a huge
Thank
level of
you.
developing research.
Thank
you.
you.